Hi everyone, namaste and warm greetings, and thank you so much for joining us today on our virtual webinar series on dignified menstruation. My name is Sharmila, and I'm here on behalf of the Secretariat Office of the Global South Coalition for Dignified Menstruation, which also happened to be the organizer of this monthly webinar series. Global South Coalition is a survivor-led network that was established in 2019 to amplify and strengthen the advocacy for dignified menstruation globally, which initially emerged from the Global South. So the coalition brings together activists, researchers, policymaker, youth leader, and community organization across region to challenge menstrual discrimination. For further information on who we are and what our work looks like, please feel free to visit our website. We are accessible. We will be available at www.dignifiedmenstruation.org, and you can also check our work through our social media channels on Facebook, Instagram. We're also in LinkedIn and YouTube. I can see we have quite a good number of participants here already, and some of them are still joining in. So please, as much as I would like for everyone to introduce themselves, I'm afraid we don't have a lot of time to do that. So please feel free to introduce yourself on the chat box. You can keep it very brief, just include a name, country you're from, and the organization that you represent, and maybe also the kind of work you do, the area of the work you do. So we can have the introduction going on in the chat box. And before we begin, I would just like to give you a bit of a background of the webinar. So this webinar series, it is a part of our learning cohort designed within the Sangpa Song project to create a feminist, inclusive, and political learning ecosystem centering, in dismantling discrimination and promoting dignified menstruation globally. So this project is supported by AFD along with the four implementing partners, that being EquipUp, Force Feminista, PSI Europe, and the Global South Coalition itself. Also, this webinar series is a direct continuation of the 2025 International Learning Conference on Dignified Menstruation and the Kathmandu Declaration that took place in December last year in Nepal, which emerged, and the Kathmandu Declaration was emerged as a post-conference document from a global gathering of over 140 participants from over 22 countries. So the declaration recognized menstrual discrimination as a root cause of inequality and gender-based violence, and also affirms dignified menstruation as an issue of human rights, dignity, power, and justice. So, from today's session, which is themed Dignified Menstruation Solution for Menstrual and Gender Stereotypes, our objective is to foster a deeper intersectional understanding of how menstrual and gender stereotypes undermine dignity, access, and rights, and also to catalyze, inclusive, right-based, and community-led actions that advance dignified menstruation across various settings. So, before we begin, I want to recognize that many of us here are coming from different time zones, different languages, and different lived realities. So, thank you so much for taking your time and bringing your energy into this shared space. Although the session will be facilitated in English, we do have simultaneous interpretation available in Spanish and French. I hope most of you have already accessed it, and if there's any technical difficulties accessing it, please um, send me a text and I'll try my best to fix it for you. Now it is my pleasure to introduce our moderator for today's session, Udita Bose. Udita is an Indian pursuing a fully funded PhD in geography at Brunel University of London. Her research interest focus on menstruation, creative methods, and participatory research. Through a competitive process, she has been awarded the PGR Travel and Fieldwork Prize 2024 by the Development Geography's research group at the Royal Geographical Society. Over to you, Udita.
Thank you so much, Sharmila, for the lovely introduction and for setting the stage for this session. I'm going to first introduce the two speakers for the day, and then we will move on to the questions and beginning the session. So we have Namkeen today, Namkeen Peshawri. She's a transgender Afghan Pashtun feminist leader, journalist, and human rights advocate based in Khyber Pakhtunkhwa, Pakistan. She's the founder and executive director of Trans Support Group Pakistan, a trans-led organization working at the intersection of health, dignity, and protection for transgender and gender diverse communities in conflict affected and resource poor settings. Namkeen has over 6 years of experience designing and implementing community led programs on psychosocial support, access to health services, gender based violence response, and dignity centered advocacy. Her work engages closely with feminist funds, UN agencies, and government stakeholders to strengthen inclusive service delivery and policy change. Namgeen brings a strong practice based perspective to dignified menstruation, highlighting the often overlooked menstrual health needs of transgender and gender diverse people, and advocating for rights based inclusive approaches that center lived experience and bodily autonomy. So, welcome, Namkeen. And our another speaker for the day is Mercy. Um, so, Mercy Yaya is a feminist governance and policy practitioner working at the intersection of gender justice, disability rights, civic space, and community led advocacy. Trained in law and policy, her work bridges research, grassroots organizing, and institutional reform. She leads and supports women and youth led movements through program design, legal, policy, and advisory um, and feminist leadership development. Mercy has worked with regional initiatives on SRHR, climate governance, and youth participation, and is the author of Feminist Leadership Through Ancestral Memory and Digital Innovation. Her work is shaped by lived experience, resilience, and a deep commitment to justice that is practical, accountable, and grounded in care. So, welcome, Mercy. And I'm going to begin with the questions. And I'm going to start with Namkeen while asking her the first question. To begin with, from your work with transgender and gender diverse communities, how do dominant ideas about who menstruates create exclusion, invisibility, and stigma? Can you share a lived experience to illustrate this?
Yeah, thank you very much, Udita, Sharmila, and our your platform to give me this opportunity. And I'm very happy today to speak on this very important topic. So, as you know, my name is Namkeen Peshawri, and I am from Pakistan, the region which is near to Afghanistan border. Yeah, so being a trans woman, like it's very important for me na. So in my context, like menstruation stigma intersects the rigid gender norms, and those norms harm both cisgender girls and transgender people, because the country which I belong is very conservative in these topics. And like talking about these topics is very much like stereotypical in our societies. And being a trans woman, I also like when we talk about menstruation, most societies like treat it as a private issue, a hygiene issue, a woman issue. But menstruation is not biological, it is political, it is cultural now. So in many contexts, it is a site of discrimination. And for me as trans woman, when people ask me this question, that do you menstruate, do you have like they ask very awkward questions from me na, being a trans woman. So these questions and all these scenarios give me courage to speak up more in the circles about the menstruation and dignified menstruation, because it means more than access to pads. It means safety, privacy, and freedom from shame and recognition of diverse bodies. Because like in my region, we have non-binary people as well, who are menstruating, but their identities are not visible to the people, and people and communities or cisgender people are still like in confusion. So uh, I want to say that dignified menstruation should include like access to affordable menstrual products and safe sanitation facilities. Na? Yeah, so menstruation is framed only as a woman issue, and it is like invisibilized trans women and non-binary people who menstruate. So I call upon the audience as well and the societies as well that this issue is intersectional, and this issue is not only relevant to women or biological women, but it is like uh, issue of all diverse communities. So when we talk the menstruation, we should include non-binary people and transgender people in these discussions. Yeah. So Pakistan has very like rigid and conservative norms and systems now. So like there are very harmful practices and ideas about the menstruation, because people or communities say that it is impurity, it is like weakness, it is something to hide, especially in the conservative and very like backward communities. So uh, it defines like womanhood. But what about the trans woman? But what about the non-binary people who, or what about the trans men who are also menstruating, but their bodies are not like assigned to their genders? So if menstruation defines womanhood, where does that leaves post-menopausal women or women with medical conditions or trans women like myself? So this is my question for you as well, and from the society and communities as well. Thank you.
Okay, fantastic. I was listening to you very carefully, and I think that leads me to the next question, because you mentioned that you are asked awkward questions about whether you menstruate, and you highlighted that whether trans women, trans men, they menstruate. So that brings me to the next question about how you also talked about menopause, that if menstruators are transforming their gender, they may go through surgical menopause. Have you come across any lived experience of the after effect of surgical menopause, specifically the physical and the mental health impact?
This question is for me.
Yes, yes.
Yeah, so in most areas, like girls are told to be quiet, and similarly, the women are also told to be quiet, and boys are also like taught not to be talk on this topic, and trans people are also erased. So yeah, this has very bad impact on the society as a whole as well, because mm, in displacement settings, like menstrual dignity becomes even more fragile, and limited supplies and overcovered facilities are also safety concerns for that people and community and women's. Yeah. So menstrual justice movement must be inclusive, because some trans men and non-binary people, um, they face double stigma, and menstruation stigma and gender identity stigma, and they had fear of buying pads, na. because they can't buy pads, because if they visit some shop, so like shopkeeper is also doing like harassment and doing some also showing that words which are very awkward and undignified na. So being misgendered as well at the clinics. So this is the main issue, that non-binary and trans men people are misgendered in the clinics, and there is also lack of inclusive language for them. And there is some like hospitals, there is no trans sensitive health education for the paramedic staff, like they are unaware to how to tackle these issues. So as a trans woman, I do not menstruate, but menstrual stigma still shapes the gender stereotypes used to attack my identity, which is like very alarming situation for me. So society links biology strictly to the gender. So that logic is used to exclude trans people. And menstrual justice just challenge essentialist gender narratives. Yeah. So
Thank you, Namkeen. And I would move on to Mercy now with a question to link it to what Namkeen has also mentioned about inclusivity and about she's brought about mentions of the public services, for example, clinics. So my question to you, Mercy, would be that from a governance and policy perspective, how do gender and menstrual stereotypes become embedded in laws, institutions, and public services? What impact does this have on marginalized menstruators?
Thank you so much for that, Udita. And I'm so excited to be part of this webinar. Hi to everyone. As you heard, my name is Mercy Ayaa. I work in Uganda. I work within the disability movement, LBQ women. There is so much to say about how policy and governance, from a policy and governance perspective when it comes to menstrual justice. I think with what Namkeen has said already, the rigidity from both our countries. In Uganda, and I would believe even in Pakistan, the perspective on policy comes from such a cultural and a taboo place, whereby the language and menstruation in itself and menstrual health, menstrual justice is only narrowed down to hygiene and sanitation. It is never an issue that taps around the human rights issue, what the gender is, and also the SRHR concern, which is extending to the wider stigma that is surrounding women and girls. Even the language that policies and public institutions will adhere to is only one that points towards to taboo the language around what menstruation is and around menstruators. I think it's even come a long way before, as activists, as people working within this space, are embracing the term menstruators in general. They would always say it's a period and all of this, but this is the impact of policy and how policy looks at what menstruation is. What in Uganda, in 2015, there was a movement and a pledge to bring free sanitary pads for schools. This, of course, did not work out because, as you understand, when policy comes in, there's so many back doors to go through before such a policy is even passed through. But when they say free menstruation and free menstrual products in that sense, I want to really talk about the free sanitary pads because that is the language that I speak that policy keeps on going back to. Of course, also there are select policy priorities that the infrastructure does not support, because then when it comes to Ministry of Education in Uganda, the guidelines that recognize menstruation as related to dignity and human rights only includes learners with, does not even include learners with disability as a priority group. When, especially within my work, that I work with persons with disability, women with disability, menstruators with disability, the priority must at least be put there, but even that is not there because the Ministry of Education and Sports will only provide, for example, reusable pads. But if you consider a woman who is a menstruator and also a person living with disability, they need to be afforded a caretaker, a welfare that would be able to allow them to live independently, be able to change a menstrual product, be able to wash for themselves. But in that facilitation, that infrastructure does not support that. In clinics, you go as far as to see that there are no free menstrual products that are just allocated. You'll see every time you go into a clinic or a hospital, there is always a box full of condoms. But despite the activism, despite a lot of work that has been started with within the menstrual justice work and with health facilities, that is yet to be seen. It is only within private clinics that you would pay for that you're going to find menstrual products that are set. Something that is so interesting is that even at hotels that you'd say are 5-star hotels, in case you get your period, you'd have to pay at least a certain amount of money to be given a menstrual product of your choice, either a tampon or a pad. But it should almost be second nature for public spaces as such, or hotels where people have access to have menstrual products ready for menstruators. But you see that over and over again, that is not there. In the same vein, the tax policies around menstrual products are insane. They are very, very biased, of course, as we see, and they're highly taxed. But policy has a lot to do with that. Recently, 2025, between 2021 to 2025, there's been a lot of conversation within Uganda about comprehensive sexual education, which includes within that the discussion around the taxation that is placed around menstrual health products, and the backlash from Parliament, and the insistence, and of course the resilience from civil society organizations to push for no tax on menstrual products has come unheard of. Because when it comes to menstruation, our policymakers, our lawmakers down it down back to what culture states for what the choice it is for menstruator, and never about the need that is present that needs to be addressed within society and within community. Back to you, Udita.
Thank you, Mercy. I think you brought forth a number of matters that you discussed. For example, you said that there is inclusivity in language and using the term menstruator, and you know how disability is not seen as a priority group. Linking to that, I'm going to ask you the next question about, in your experience of working with disability rights and civic movements, how do menstrual and gender stereotypes deepen the exclusion for people with disabilities, rural women, and young activists?
Wow. There's so much to say on this. I think there's several issues to look at when it comes to the stereotypes. And for women with disabilities especially, the stereotype is one that the sexuality that comes with, the attachment that comes with living with disability, that in the first sense, you're not even recognized as a sexual being, That's one. So it's already erasing your identity, your experience in that sense. For rural women and for young activists, the conversation there is unheard of, because you would not be able to have that conversation without backlash that comes from every part that is present. For women with disability, there is a morality, more responsibility for them to abstain and not to have any involvement of anyone else or involvement of their bodies to experience menstruation, to experience sex, to experience pleasure. And yet the experience is one that is already one that you live with. I already spoke about the hygiene aspect of it, but when it comes to that, the decision then really boils down to the bodily autonomy, that exists within that, do I have the right education about what menstruation is and how menstruation occurs? That for someone with a disability, and not only boiling it down to a physical disability, but psychological, cognitive disability, some menstrual products can even be intrusive. For example, someone who has vaginismus is not able to use a tampon or a cup, a menstrual cup, because how are you able to? But the education within that, the stereotype is that everyone uses the same type of menstrual product. Education is not put within those. There is also consent and decision making for rural women, and I think this is also common for menstruators who are living with disabilities. Consent and decision making, that it's untoward you that to use only what is provided for you, or the need for a caregiver. It's easy to work within that space as someone who is able to go to the bathroom, change a pad, but when you require assistance of someone else, it's almost intrusive. You don't know how to handle, where do they touch me, how comfortable am I in this space, or what are the risks therein for abuse or harassment. Because again, the stereotype around menstruation, the myths and the misconceptions that it's blood and therefore it's dirty and therefore I can't touch it, and yet this is the normal bodily autonomy that then happens. Another stereotype, for example, and I don't know what the audience feels about, is the conversation about reusable pads. How, as much as it's very, very innovative, but how receptive is it? Is it only addressing the problem of rural women or poor women because the taxes, for example, on menstrual products are so high, and therefore you use what is available to you? But is water accessible in that sense? Yeah. Teachers may even, I think there's a whole section, when I remember when I was in primary school, when we were talking in biology class and we were talking about menstruation, there's a lot of giggles in the class, because as soon as the term menstruation is brought up, the boys laugh, the girls laugh. There is shame around there. And I think this goes even as far as to teachers, that they skip menstruation content due to the discomfort around it. Community norms will discourage open discussions. I'll give you an example. In my culture, I'm Luo from Uganda. We hate from northern Uganda. When I was learning and researching about menstruation, the language around menstruation and how women in my grandparents dealt with menstruation, I learned that during menstruation, you dig a hole. There's a separate hat, for example, that is already put out during menstruation. So women that are menstruating during the week of menstruation, because of course in those days they'd only consider women to menstruate and no one else. There was no any other identity that is considered. You sit in a hat and dig a hole and sit in the hole and let your body do its work. You're not allowed to come out. Food is placed outside the door. All of this shame that puts you in a different place to deal with this bodily this normal body functions that you experience as a menstruator. But that stigma, even in 2026, has not gone away. It's still, you can't mention it in rooms with your, even with parents. What are some of the opposed, the detailed sexual education that even includes menstruation? For young activists, there's a moral panic around menstruation and menstrual justice, around the comprehensive sexual education that includes this. Because what's menstrual equity in this sense? There is you are between the line that you are promoting immorality, because in our country, when Uganda, when this conversation about comprehensive sexual education, menstrual health comes in, SRHR is a flagged term, because then you are seen to be promoting homosexuality, you're promoting LGBTIQ. Any conversation that even leans toward sexual education is already one that is that. So for young activists, there is a fear already that is present that, am I undermining my culture? But what does culture say in that sense? Or you are accused by police, by anyone else who hears you talk about this, that you're advancing foreign agendas in this essence. And so they end up facing a lot of online harassment. Funding becomes riskier. In a study that was done, is that feminist movements, movements and organizations receive way less funds, even one attached to menstrual health. And even the civic engagement, for example, this is scrutinized through a moral lens, is the language that you use must be polished. You can't say vagina, you can't say menstruation. There's so much to say about all these things that kind of lets you police yourself, because the effect is that when they look at you, you must be acceptable within society, within community. And yet menstruation is political for most of us and for menstruators, because it is a bodily function that you'll experience until you don't, or even when you do not. It is political because you know the experiences of menstruators. Back to you, Udita.
Thank you so much, Marcy. And I think you brought up the discussions about caregivers and touch, and I think that will take me to the next question to Namkeen, where I want to know that, how do menstrual stereotypes intersect with transphobia, poverty, displacement, or conflict in your context? What unique challenges do gender diverse menstruators face in accessing care and support? Namkeen, if you would like to answer the question.
Yeah, so yeah. So there are I'm thinking that this issue is not only in the global south or only in Pakistan, but it is an like issue which is everywhere now. So uh, like in global south realities and economic justice, we say that there is poverty everywhere, and there is a lot of like taxes also on the menstrual products. And Pakistan is a climate disaster prone country. So there is a lot of like intersectionalities also, like very much near to that issue, because climate disaster disrupting this supply very badly now. And in rural and urban areas, there is a lot of divide between the menstrual hygiene and people who are using this now. So connect to climate justice, like floods in Pakistan disrupted access to sanitation facilities. like menstrual dignity collapse first in these crises. Yeah, so we need like comprehensive sexuality education on the issue, and we also need gender inclusive language in these, and also affordable or free menstrual products for the communities, safe sanitation infrastructure, and refugee inclusive policies. In Pakistan, like millions of Afghan refugees are residing. So the refugee women and girls are especially very much vulnerable in this area. And we also like need in Pakistan like trans inclusive health services, and we move from charity model. This is very important thing that we must move from the charity model and distributing pads once a year. Like this is the approach which is the international NGOs are doing now, to so we have to move towards the rights based approaches now, that we communicate and sensitize the communities that this is a human right issue. This is not the issue which is like your masculinity or something that patriarchal norms are suffered, or you can uh, so menstrual dignity is not a donation issue, like it is a human right issue. So we have to call upon the countries, the administrations, the civil societies, to connect it to the SDGs. So we have to connect to SDG of education, and we also have to connect with the SDG of health, and to SDG 5, obviously gender equality. So if we connect this issue to these SDGs, I think the government will be capable to implement these now, and they prioritize this issue. So we have to call upon the international departments and country departments that menstrual dignity is not a donation issue, but it's a human right issue. Yeah. So dignified menstruation is about rewriting the story we tell about bodies. Like it is about challenging the idea that biology determines worth. It is about ensuring that no one, like cis, trans, refugee, rural, poor, uh, loses dignity because of a natural bodily process. So this is like natural bodily process. We have to think on this. And the other thing is, for me, is religious leader. In country like Pakistan, Afghanistan, in every country, religion plays a very like important role. So we have to call upon to the religious leaders, like in Pakistan, Islamic scholars, mullahs, and the persons who have like strong say on the communities. So we have to call upon to them that they dismantle menstrual stigma. So when we dismantle this gender stereotypes, and when we dismantle gender stereotypes, we will open spaces for everyone to live with dignity. Yeah, so I must say that menstrual justice is gender justice. Dignity is like not a luxury thing. It is a human right and right. So, like uh, in menstruation, we always defines man womanhood. Where does that leaves post? Yeah. So in Pakistan, like teachers are also uncomfortable to discussing menstruation, and mainly like male teachers are also dismissing it because of their patriarchal thinking and thoughts and everything. So yeah, there is a lot of dropout is also because of this menstruation, because in Pakistan, mostly girls are when they are 12 or 13 years, they are crossing the primary level of education. So there is a lot of emotional distress and trauma, and there is also Pakistan is a very like in alarming of global index of early marriages as well. So there is a risk of early marriages as well, which is related to this. And in displacement settings, uh, like menstrual dignity becomes more fragile. It very limits supplies. And the other thing is like I want to throw your like reflections towards the MHPSS, because like mental health and of a person is also, or a young girl is also very much suffered because of that issue. So there is no mental health support issues or services, support services available. So we have to ensure that mental health and psychosocial support services should also be available for the young girls, for the transgender, for the non-binary people who are like going through this all things. So the family is also not supporting, because mostly parents are uneducated, they are shy, and they did not like in a situation to cope up and to sensitize their children, especially in the cases of trans men and non-binary and transgender cases. uh, Families are also very much reluctant, the parents, the near family members, and they like also doing a type of like violence or emotional violence to the uh, this you can say diverse communities, because they did not support them in this. So I call upon on the society that this is not only biological thing, but it's a human right issue. So please include all gender diverse population, and please break the silence, and speak on the issues. And there are also like trans women like me who are openly like describing these issues and speak up about these issues. So we also faced a lot of like harassment and also opposition from the religious leaders because of the stigma related to that issue. So there is a lot of like internalized
Sorry,
stigma
Namkeen,
related to
I will
that.
just quickly intervene and just add up to what you're saying about you brought in a very intersectional and wholesome perspective.
Yeah.
About how you mentioned a rights-based approach, how you said that, menstruation is about gender justice, the rights-based approach. And you mentioned about how there are refugee women and girls in Pakistan, and, how various measures need to come about. So quickly, I'm just going to ask you that, what is the role of the government in all these matters? If you could quickly just, share about what you've observed about policy changes, or what kind of policies are being implemented by the government.
Yeah, the government plays a very important role. And when we talk about the menstruation in Pakistan, we are not just talking about the biology, we are talking about gender norms, dignity, education, health, and power. So government can play a very big role because girls are expected to manage it quietly, and boys are rarely educated about it. So teachers like often avoid the topic. So my suggestion is that we have to sensitize the teachers on this topic, and this can do by the government. And government has the responsibility that ensure these type of facilities in the every like BHU, tertiary hospital, THQ hospital. And they have to like do this commitment to the paramedic staff, and they should provide these type of services in every hospitals. Like we are in our mind that hospitals are only for the like other subjects, but we have to ensure that government should involve paramedic staff and doctors to sensitize communities on that topics. And the other thing is schools can play a very important role, and schools are under the government of Department of Education. So this should be like that they facilitate the products, na? And this is the state responsibility. It's not family or private issue. So recognize menstrual health in public as public health issue. So the government should recognize menstrual health as a public health issue and integrate into national gender policies. This is very much important that the government should integrate it into national gender policies and treat it as a developmental priority. Yeah, and the one biggest role of government can be like they should provide clean toilets, they should provide privacy, disposable systems, and running water for the schools, and they directly will be affect like school attendance of girls as well. So ensure gender segregated safe sanitation facilities, integrate menstrual health into school curricula, which is very much important, and train teachers to discuss menstruation confidently, and yeah, and include boys in the menstrual education to reduce stigma. This is very much important that we should include boys, women in the menstrual education, that is stigma should be reduced, and also provide accurate information through lady health workers. In Pakistan, lady health workers are playing very good role, that they are disseminate the information from house to house, so they can provide accurate information through lady health visitors or workers, and include menstrual disorders in public health messaging. This is very much important, and ensure that rural and low income communities have access to affordable products. Yeah.
Yeah, thank you so much, Namkeen. I think that gives us a very wholesome picture. And
And the other thing which government or international idare or departments can do is to remove or reduce taxes on menstrual products, which is very much important because menstrual products are also very much expensive for the rural and like poor communities. So they also removed and reduced taxes on the menstrual products, which is very much important, and also support local low cost production, which is like very important. Yeah.
thank you so much. I think I will now quickly go back to Mercy about and relating it to what Namkeen has mentioned, about sensitizing communities. So, Mercy, my question to you would be that, how far are the community-led approaches rooted in care, ancestral memory, and digital innovation have been able to inform government policies to be inclusive of disabled menstruators?
Yeah. I think when the conversation on menstruation comes as it is, we only think about menstruation in a westernized idea of it, that use of menstrual Western rights language that kind of zeroes it down to the experiences that we always interact with online. But in my community, I'll give an example of last year within the end, we had a 3-day a dignified menstrual health, what is it called? Conference and seminar. And the point of it was really to just talk about what does dignified look like for a rural woman or myself, who English is a second language to, what are some of the things that we can take back within the Global South and use the right term to link it back to menstruation. And this is where the ancestral memory comes from. I know that culture is harmful in a way, but hearing even Namkeen speak and say the lady health workers do a lot of work is that our mothers had a way to talk about menstruation and the experience of menstruation. And so the framing around there is that we need to revise some of the westernized rights language and try to marry it with what we've always known menstruation and the experience of menstruators to be. And also, what are some of the care approaches have been the communal responsibility for menstruators and redefining what responsibility means for a menstruator. That I do not have to hide my body, I do not have to hide away. I can speak boldly about the menstruation. I don't know if maybe even the audience has seen, but if, for example, on X, and I can attest that community has definitely taken up on this, is during ovulation or during menstruation, you will see tweets from women and menstruators and feminist organizers. They'll just be like, it's ovulation week. Remember to take care of yourself. Eat a cookie, get chocolate. Or someone would just post that it's menstruation week and I'm in pain. And you will see a lot of rallying behind those experiences. And also, some of the messaging has come through social media by talking about the reproductive health diseases that are linked to that menstruators experience. For example, endometriosis and PCOS, that as a person who is experiencing some of these illnesses that have no medication for it now, doctors don't exactly know how to handle the issue at the moment. Menstruation within my community has become a topic that is easily embraced. Now, is there implementation? Not exactly, but I would say that community has definitely taken on the burden, the responsibility, I don't like the word burden, the responsibility to do a lot of education, despite the backlash that has come from policymakers, from parliament, and so much so to even expose some of the infrastructure the infrastructure within schools and health facilities, within even private clinics, and how they frame menstruation. We've done a lot of work to clinics and health facilities whereby community organizations will just take pads themselves to public hospitals and put a box and say free for use for all menstruators. And so when you want a pad or you want a menstrual product, any of them, because then they're categorized. So through these donations, they are there and ready to be used. Of course, as you would expect, the menstrual products don't stay so much. They don't take long on the shelf because they are needed, and therefore they get done very quickly. Because this really is just to show that there's a lot of community need for accessible menstrual products. Also, the work that has been done is to pressurize a lot of district officials to engage, especially within community officials and like direct district community officials, to position menstrual justice as one of the things that is tabled within Fridays, where they have like a weekly meeting. There's a lot of work that has also, and a lot of pressure that has been put within Ministry of Gender, Labor and Social Development, which in essence, in Ugandan context, are the primary ministry that should take on the responsibility of educating and creating awareness around menstrual health and menstrual health and menstrual justice. In digital innovation, I highlighted a little bit about how Twitter has been used, but there's also been ways in which short films have been made, community documentation that in a way is like a living archive In 2024, beginning of 2024, I think March of 2024, there was a campaign of the different menstrual health products that are being used. And so an organization that I was working with at the time did a little bit of an exhibition that showed exactly what this means, explaining each product and how it can be used by a menstruator and what budget it looks like. And this really has created a lot of visibility, and also the control within that, particularly when you think about the accessibility of even toilets, when you think about menstruators with disability. What does that mean? I think that is some of the work that we need to still put forward with policymakers, with health facilities, and also the caregiver control over disabled menstruators. Are we really scrutinizing and also holding caregivers accountable in how they treat disabled menstruators? Are they part of the conversation when it comes to menstrual health? Because it's not so much the physical, but also the mental health aspect that comes with menstruation, that there's a high risk of depression, that I'm stammering, the depression that comes just before your menstruation or after, that is there all of this work that can be brought to kind of highlight the danger that comes with experiencing menstruation. And so there is a lot of work that we need to do collectively to translate the visibility that we've created through ancestral memory, digital innovation into like structural reform that amplifies voices, that Namkeen said, accessible, comprehensive sexual education, disability inclusive product innovation that is not yet mainstream, that if I have anxiety around using a menstrual cup, do I have the education that allows me to understand how to use a menstrual cup or alternative menstrual products that would be able to allow? This is applicable both, of course, at local levels, which is rural, of informal support systems, that you need the only way I could say is a senga in our sense, is a figure that you trust, that you're able to trust to explain your experiences to, and they are able to teach you what menstruation and the experience that you're going through looks like. Of course, to create peer networks that reduce stigma and care
Mercy,
centered. Yes,
can you hear
sorry.
me? Sorry, I have to intervene because we have gone a little overboard on time. And I think the
Yes.
discussions are so interesting that, it can keep us in loop and it can keep going on because there is, I think, no end to these very fruitful discussions that both you and Namkeen have brought about and made us think. So I think I'm going to quickly pass it on to Sharmila, and she's going to just conclude the session for us. And if any of you have any questions to the speakers, I'm sure they can put in their email IDs in the chat box, and you can email your questions to the speakers.
To just do a bit about the filtering stuff.
Yeah, thank you so much, Adita, for the wonderful facilitation. And I'm so sorry we went a little bit overboard with the time, so we couldn't have uh question and answer session at the end. That was the idea at the beginning, but then the discussion took over longer, and I'm afraid it's not very feasible for everyone. So just to wrap it up, and thank you for our incredible speakers and bringing out such insightful discussions here today. And just to wrap it up for today's session, from just hearing from our conversation today, one thing has been very clear for me and also for all the speakers, I believe, that menstrual and gender stereotypes are not, small misconceptions. They are deeply embedded in the systems, and they define who is seen as a menstruator, whose pain is legitimate, whose needs are funded, and whose dignities are denied or valued. And as we hear today, these stereotypes are deeply embedded in our language, in our institutions, policies, and even in our everyday interactions, how you speak, how we view things, how we talk about it. So we were reminded that even when menstruation is framed, in narrowly, when we just call it as a biological issue, or when we just call it as a women issue, there is entire other communities that we are making them invisible. So gender diverse menstruators, people living with disability, and people living in conflict area or in displacement, rural communities, and younger people, they have been invisible with that choices of framing, and since that they have been facing all these layers of discrimination ever since. So these are not an individual challenges, if we see, and they're outcomes of unequal power relationship that we must intentionally dismantle. And this is something we strongly advocate within Global South Coalition for Dignified Menstruation. But today we didn't just only discuss about problem, we also discussed about solution. We heard clearly that dignified menstruation, it demands survivor-led community approaches, policy transformation, accountability, and care-centered leadership. It requires governments to recognize diversity and experience of diverse menstruators, and it calls for movements rooted in lived realities, right knowledge, and collective power as such. So with that, I believe we have come to the end of today's webinar, and it's a bit rush at the moment because of the time bound. And I hope you enjoyed it as much as I enjoyed. And on behalf of Global South Coalition for Dignified Menstruation, I sincerely thank you for walking with us in this collective journey towards dignified menstruation. Thank you so much. Thank you all. And I wish you have a wonderful rest of the day and happy weekend.
Thank you all. Thank you all.
And
Thank you.
and then just
Thank you,
a last
Sharmila, for
announcements. We have this webinar every month. Yeah, I hear someone was speaking.
I think we've lost them.
Oh no.
Yeah.
I thought it was just a background sound, but then again.
thank you, Sharmila, for getting us